Well, whether you're an avid runner, high school athlete, or a diabetic or patient of any age, there are a lot of issues that can impact your foot and your ankle. And joining us now from Orthopedic Associates is Dr. Thomas McDonald. He's a premier foot and ankle specialist. Thanks so much for being with us, doctor.
Thank you for having me.
So tell us a little bit. I know you have quite a lot of experience, but what exactly do you specialize in?
Well, I thought you'd never ask. So I'm an orthopedic surgeon, and my subspecialty is foot and ankle. At the core of what I do is orthopedic surgery, which is the science and medicine of human movement and motion. And within my field, many of us kind of pick a body part to get extra training in, and mine was foot and ankle. So I did a fellowship in foot and ankle surgery.
Yeah, those are the injuries, at least in my own experience, that you're not usually expecting. Something happens, you twist your ankle, you do something you didn't know, or you're playing a sport. They seem to happen kind of suddenly. So how do people know whether they need you or they just need to put their foot up?
Right. Yeah. So much of what I see, Kara, is that oops moment that you're referring to, be it, checking the mail or chasing your kids or trying to stay active and healthy. And sometimes the price we pay for that is one of those moments. So the obvious, moments like that are, you'll know it when you feel it, and you'll seek help. But, a lot of what I see is not the dramatic tendon rupture or broken ankle. It's just the repetitive kind of aches and pains of life. And to your point, sometimes it's hard to know the difference. Is this part of what it feels like to approach a certain age, or is this something I should be worried about? A lot of orthopedic surgery and musculoskeletal health revolves around being able to listen to our bodies and to know the difference between pain and injury. And sometimes it's subtle. It can be a chronic, repetitive thing that happens with your favorite recreational pastime, such as running or golf or recreational walking. And you start to feel that this season or this round or this day is not the same pain that I'm used to feeling. Those are kind of self-awareness moments where sometimes it pays to check in. A lot of patients I see are just looking for that reassurance that, with a simple x-ray and a simple history and physical exam, we can give people peace of mind that this is not something to worry about or not something that's going to keep our activities down or slow our season down.
Okay, and so if you're at home and you do get injured, I can remember this happening to me. I was just trying to do one of those at-home workouts, and you twist your ankle, and you're like, "Is that broken? Is it sprained?" You're in denial. But what steps do you need to take right away?
Well, again, knowing the difference between pain and injury is sometimes tricky. But if you're having a hard time walking heel to toe, if you're having a hard time actually putting weight down on your foot or ankle, that's cause for concern, and maybe time to get an x-ray, certainly time to get a good physical exam. And those moments, as I say, you'll know it when you see it. And more subtle things that I see are, for instance, the itises that rear their head, plantar fasciitis and tendonitis.
Yes.
And these, don't often present with one acute moment. It's kind of after a few days of doing that, or the second day after you do it, you're feeling that. So a lot of musculoskeletal problems that bring people to the doctor are, this has been going on for a week, 2 weeks, and, most people have a short attention span and a very low tolerance for pain that lasts beyond 5 minutes or 2 days, certainly. So a lot of people come in and they want to know why it still hurts 3 days later or a week later. But, 1 unit of time in my specialty is considered 6 weeks. And so if something's been aching and bothering you for more than a few weeks, it's time to start calling for an appointment, I feel.
Okay, so and I know that you can get in. A lot of times you have good hours for people and different urgent care options, so we'll have that information for folks to find you on the website. But some kids are heading back to sports, depending on which sport it is. And as a mom, I think you always wonder, you don't want to overreact, but when should you play through the pain?
Right. Well, my coach used to say, if it's the playoffs, you're playing through the pain. But I think, to be responsible about that as a parent and as a coach and as a player, to know your own body. Um, Again, if you're limping, if you're having a hard time taking a step or a cut or a pivot with authority, if you're having to think about making those quick motions, that's when I think people are at risk for real injury. If you're not able to really play full speed without having to gear down or alter your gait, that's usually biology and Mother Nature telling us that something is either injured or trying to heal from a repetitive injury. So I
Yeah.
think not being able to play full speed is a warning sign.
And you're currently seeing patients in Hartford, but I know that you'll also be seeing patients at Orthopedic Associates' newest office in Enfield that's opening in October. Give people an idea if they're listening to this and thinking, gosh, I need to remember, oh, if I get in trouble, go there, or you're already hurting at home. Where are your offices and what's the best way to get seen the fastest?
Sure. Well, I've recently joined Orthopedic Associates, and it's a real pleasure to spread. We kind of pride ourselves in having instant availability, both with our urgent care centers and with our daily office operations. We're spread through Glastonbury and Farmington and Plainville, and now, as you mentioned, north up to Enfield. Hartford is our central location. Um, so we do our best to get people in for those acute concerns or those nagging pains. We've got ready availability for all of my partners, and we have a wide array of mid-level extenders and physician assistants that are a huge part of how we try to serve people.
I know I've also done stories on some of the urgent care offerings that you have, so it's always a good idea, as the doctors tell us, call sooner rather than later.
Right. Yeah, we're always happy to see you, especially if it's just reassurance you're looking for. That's a quick visit, and I always feel like that's a big part of what we do. Clearly, our business is in acute musculoskeletal trauma and the oops moments and the things that don't go away with rest, ice, compression, and elevation. But a lot of what plagues us in our daily activities and with our kids and in our communities is not necessarily the showstopper injury. It's the ache and the pain and the itis.
You just talked about RICE, rest, ice, compression, elevation. A lot of people hear that. If they haven't and it's new to you, that's a term I learned early on when I had kids. Is that something you recommend, that as soon as you have one of those injuries, when you're trying to think of what you should do or shouldn't do for yourself or your child, is RICE the first thing you should do?
Right. It makes such a big difference. It's such a simple mnemonic to remember and such an important part of kind of urgent level care. But in my specialty, even that simple adage goes a long way. It carries people fairly deep through even severe injuries. A lot of times people will have an acute injury and be able to walk it off. Then what really starts to worry them is the next day, the next week, when the bruising starts and the swelling really sets in. That's when we start to have symptoms like numbness. That's a common thing that really worries people. And it goes hand in hand with swelling. When our ligaments are swollen, all of our soft tissue is swollen, even the nerves, people start to get numbness and burning and things that really start to cause anxiety. So controlling that swelling early on makes a big difference.
Make a big difference. Now, what about things like hammer toes and bunions? You guys take care of those as well, right?
Right. Not many people enjoy talking about feet, so this is a real treat for me. But that's certainly part of what I do. In my subspecialty of foot and ankle, we're focused on not only the acute trauma and the things that are broken, but also disease processes that extend across the arc of age and activity, from kids with congenital abnormalities to young athletes who have a sports-related acute trauma, to the aging athletes that are feeling the effects of their athletic past. And I enjoy working with a wide array of subspecialties. That's one of the things that's great about orthopedic surgery. We're always smarter when we work with other people who are smarter than us. So working with rheumatologists and neurologists for a wide array of problems that affect a wide age range of patients is what I enjoy.
Yeah, and there absolutely are options for people to get those taken care of. I'm just trying to check our Facebook feed to just see if anyone has any questions. A lot of people singing your praises, saying you're a great doc, and love having you, excellent care. So you got some nice things. Some people are asking about cortisone shots. Should you get cortisone shots?
Sure. Cortisone is an old orthopedic trick, so to speak. It's a powerful anti-inflammatory, and in certain conditions, it can really take the acute pain away from the patient's experience and give people some immediate relief. It doesn't always work. Not everyone responds to it. The first thing I ask patients when they're considering that is, have you had one before and has it worked for you? And many times when people have that dramatic response from injuries past, they'll realize that again. It is a temporary cover-up many times for the acute inflammatory process, but it can be a big part of getting through one of those acute moments.
Yeah. And I know that you're concerned also with patients who have diabetes or rheumatoid arthritis, that they can also encounter issues that might impact their lower extremities. And are you concerned even more because of the pandemic? And I know some patients are still putting care off.
Yeah, absolutely. And an understandable instinct for a lot of people, particularly when there's a baseline medical problem or condition and they're worried about their health reserve, so to speak. And I think it's important for us to stay vigilant about public safety and keeping our distance and following the rules and regulations of our communities and our healthcare advisors. But what I've really been proud to be a part of is working with an institution like OAH and with the Bone and Joint Institute that really focuses on public safety and allowing people access in a safe and responsible manner. I think the health community here in the Hartford area is doing a fantastic job with that, and I've been proud to be a part of it. So it is safe for people to seek out care in a responsible and controlled way, and we're working hard to give patients that option.
Absolutely. You know, in our final time together, two questions that I want to see if you can answer. Is there anything that can be done about nagging plantar fasciitis? I know people have suffered with it, and it's a little bit of a struggle sometimes to get it under control. And also, people want to know, are there some holistic things you can do, like foods or supplements in general, just to keep your body healthy so you can reduce aches and pains?
Sure, great questions. Plantar fasciitis, you mentioned, it is such a common part of what brings people to a foot specialist. When it's bad, it's bad. And I've seen patients, who really are limited by that. There's a number of things you can do. A lot of them fall under the umbrella of stretching. And in my world, we often say that a tight calf is the root of all evil. So a big core component of conservative management for plantar fasciitis involves calf stretching. I think of our calf as our big shock absorber for our foot and ankle system. And if that calf is tight and not absorbing the shock of our daily activities, the stress and the injury falls to the smaller shock absorbers, so to speak, like our plantar fascia. So calf stretching goes a long way.
All right, stretch our calves. All right, that's good. That's a good tip to know. And what about foods? Do you recommend any supplements or foods just to keep general inflammation down in the body?
Well, that's a great topic, and truthfully outside the specific zone of my expertise.
Okay.
I'm married to an organic and whole foods lover, and she would speak at length on that topic. But I think, in general, balanced diet, one that focuses on low processed sugar and, responsible caloric intake is one that's going to really work in the whole system to kind of keep our weight down and keep us healthy and keep us moving the way we want to.
Yes, I've interviewed many people like your wife, and just to throw it out there for the people in the feed, many people suggest taking a very high-quality fish oil to reduce inflammation, magnesium to keep your muscles strong and flexible, and avoiding those anti-inflammatory foods. So that's just me.
I feel like I'm right at home. Thank you.
Yeah, there you go. I'll speak on behalf of your wife and the many naturopaths that I have interviewed. But some people are asking how to get a hold of you. I want to let people know they can get information by going to oahct.com, oahct.com. And also, if you want to shout out the phone number or the best way for people to get in contact with you.
Yeah, thank you so much. I was afraid you'd ask that. I mentioned that I'm fresh here in my office, so go to our website. We've got a bunch of direct numbers that give you easy access.
Yes,
and
that is
this is
what
where
I
I
have
wish
too.
my assistant Donna was next to me.
Well, I'm on your website now, and I will say one of the numbers, there are many here, but one of the numbers specifically, as I was reading your biography, and people can do that, they can learn about your time in Tennessee, but there is a number here I'll say that's 860-244-8889 specifically, what came up when I Googled your name, but I know you've got a whole practice there and offices in convenient locations throughout the state, so I'll shout that out again. If you go to oahct.com, people can get all the information they need right there.
Thanks, Kara. Thanks for that. I'll write that down.
Okay. That's okay. We know you, doctor. You guys need the people to handle the phone numbers. Don't worry.
We need some detailed people.
All right. Thank you so much for being with us and sharing your time.
Thanks for giving me the opportunity. Have a great day.
You too.